Good morning, everyone, and welcome to Webinar Wednesdays with SMP. We're glad to have you all here with us this morning. My name is Sunny Lawless, and I'm the volunteer coordinator for our SMP programs, and I'm going to be your host for this morning. Presenting for us today will be Nathan Coughlin, who is one of our Georgia Community Outreach Specialists, and Yolandra Moody, who is in Louisiana, and she's also a Community Outreach Specialist. Today, for the August installment of our Webinar Wednesdays with SMP, we're going to learn about pharmacy and prescription drug fraud. During the presentation, you're welcome to type in any questions that you might have into the chat, but we're going to hold all questions until the end of the presentation when we open it up for Q&A. So before we get started, I do need to let you know that this project is supported by the Administration for Community Living, Department of Health and Human Services as part of a financial assistance award with 100% funding by ACL-HHS. The contents are those of the authors and do not necessarily represent the official views of, nor an endorsement by ACL-HHS or the U.S. government. So who is Senior Medicare Patrol? Well, if this is your first time joining us, SMPs are grant-funded projects of the federal U.S. Department of Health and Human Services and the Administration for Community Living. All SMP grantees have a shared national identity through a national program name and logo. Every state has a Senior Medicare Patrol. In Georgia, Louisiana, and Mississippi, SMP is sponsored by AdviseWell. And our mission is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do that through outreach, counseling, and education. And last year, we celebrated the 25th anniversary of the SMP programs. Now, before I turn things over to Nathan and Yolandra, I do want to do a quick poll for you all. Our polling question for today is, do you have a prescription drug coverage as part of your Medicare plan? If you'll give me just one moment, I'm going to launch that poll. There we go. So do you have prescription drug coverage as part of your Medicare plan? And for our answers, we have yes, no, and I am not on Medicare. And I'll give y'all a few seconds to make your selections. Okay, we're at about 65, 70% voted. I'll give it about 5 more seconds and then we'll close the poll. All right. So there we go. So there we have it. So it looks like about 42% said yes, they do have a prescription. They do have prescription drug coverage as part of their Medicare plan. 8 said no, and it looks like about 50% of you are not on Medicare. All right, so now I'm going to hand things over to Nathan, who is going to get us started with the presentation on pharmacy and prescription drug fraud.
Hello, everyone. Thanks for joining us today. So Medicare prescription drug coverage is also known as Part D. It's the part of Medicare that covers most outpatient prescription drugs. If you have a Medicare Advantage plan, your benefits could include prescription drug coverage as part of your plan. Medicare Part D is a separate insurance plan that is offered through private insurance companies for those enrolled in Original Medicare, Parts A and B. It's the red, white, and blue card. The availability varies by state. These plans cover prescription medications for outpatient services. Most prescription drug plans charge a monthly fee that differs from plan to plan, and you pay this fee in addition to your Part B premium. Next slide. Pharmacy and prescription drug fraud is a consistent trend in Medicare. Criminals ranging from healthcare providers to drug trafficking organizations continue to commit prescription drug fraud because it's very profitable. Unfortunately, there is a strong illegal market for prescription drugs, including controlled drugs such as opioids and expensive medications. Next slide. Now we're going to look at some of the types of pharmacy and prescription drug fraud scams. A pharmacy intentionally provides you with less medication than you're prescribed. Also, a pharmacy issuing you expired medications. Additionally, a scam would be you are provided with and billed for an expensive compounded medication, including topical pain creams, when a traditional or less expensive prescription was ordered by your physician. Next slide. Here are a few more types of pharmacy and prescription drug fraud types. A company offers you free or discount prescription drugs without a treating physician's order, then bills Medicare. A pharmacy automatically refills a prescription you no longer need. You do not pick up the prescription, but the pharmacy still bills your Medicare. An individual offers to pay for the use of your Medicare number to bill for prescription drugs, or offers you cash or other compensation to pick up prescription drugs on your behalf. Next slide. So all of this ties into potentially medical identity theft. Medical identity theft could be another component to pharmacy and prescription drug fraud. You should always be wary if someone requests your Medicare number and other personal information to evaluate your prescription history at health fairs, senior centers, assisted living facilities, malls, farmers markets, home shows, parking lots outside of retail stores, or privately sponsored wellness events. Medical identity theft occurs when someone steals your Medicare number to submit fraudulent claims to Medicare without your authorization. Medical identity theft may disrupt your medical care and could result in financial harm. SMP, we always say guard that Medicare number just as closely as you would a credit card number, because in the wrong hands, it can be just as valuable. Next slide. You might be wondering how to spot pharmacy and prescription drug fraud. So be sure your doctor has assessed your condition before prescribing you any medication. And again, do not give out your Medicare number or other personal information to unknown individuals requesting it for prescription drug services. Next slide. Review your Medicare summary notice or explanation of benefits, also known as MSNs and EOBs, for the charges for the following: prescription drugs, including refills that were never picked up, delivered, or even prescribed; prescription drugs, occasionally controlled substances such as opioids that were prescribed by a healthcare provider you have never even seen; amounts beyond the quantity you were prescribed; a different prescription drug, often a more expensive drug than the one you were originally prescribed, or a drug that is not approved by the U.S. Food and Drug Administration. Next slide. So now that you know who SMP is and what we do and a little bit about prescription drug fraud, Yulandra is going to discuss the 3 keys to success in stopping healthcare fraud, waste, and abuse through prevent, detect, and report. Yulandra, take it away.
Thank you, Nathan, and good morning, everyone. I'm going to talk about the 3 main ways that you can protect yourself from Medicare fraud. We're going to discuss how you can prevent it, how you can detect it, and how you can report it. Next slide, please. The first key is knowing how to prevent it, how to protect your personal information. It's your best defense against healthcare fraud and abuse. As Nathan said earlier, you need to treat your Medicare and your Social Security numbers as if they were credit cards. Never give these numbers to a stranger. Medicare won't ever call you. That's an important thing to remember. If you get any phone calls and someone identifies themselves as being with Medicare, you should be leery. Medicare will never call you, and Social Security will never call you. So be leery of all of those phone calls and report them immediately. Hang up on those phone calls. Don't engage. Don't carry on a conversation. You should also not carry your Medicare card with you unless you need it for a doctor's appointment. If you're seeing a new doctor, they're going to need that card. They will make a copy of it. It will become a part of your file, and it's likely you won't need that card again for that particular healthcare provider. So don't carry your card. If you lose your purse, lose your wallet, then you've lost your Medicare number and you can become a victim to fraud. Keep a record of your medical visits, your tests, and any procedures that you have, either in a healthcare journal or on some type of calendar or list of your own. Sunny is going to tell you at the end of this presentation how you can acquire a healthcare journal from SMP. Next slide. Your second key to preventing fraud is to know how to detect it. Knowing how to spot suspicious activity can help you stop healthcare fraud and abuse before it even begins. The number one way you can detect it is to review your Medicare summary notice or your explanation of benefits. Your Medicare summary notice is mailed to you by Medicare every 3 months. If you have an Advantage plan, you'll receive an explanation of benefits after you receive your healthcare services. The EOB or the MSN is a statement that you receive that will contain everything that Medicare has been billed for. That statement, that EOB and that MSN, should be closely compared to the healthcare journal where you've kept a record of everything. If those two don't match up, there could possibly be a problem. It could be an error, it could be some type of abuse, or it could be fraud. But review that carefully each and every time. Compare your statement directly with your personal records. Look for charges for something you did not receive. Look to see that Medicare was billed for the same services or supplies more than once. And check for services that were not ordered by your physician or healthcare provider. Next slide. Lastly, we're going to talk about reporting suspected fraud, errors, and abuse. If you suspect you've been a target of fraud, report it. This is going to help you and others at risk for healthcare scams. Don't be afraid to report something that you don't feel sure about. If you suspect it, if you feel funny about it, if you don't feel comfortable with something, if you just want to be sure, feel free to call us at any time. If you receive a suspicious call, don't give out any personal information. The smallest piece of information you give them can aid them in fraud. Don't give out your date of birth, your social security number, and most definitely don't ever give out your Medicare number. If you do, report it and call SMP immediately. If you have questions about your statement, you can call your healthcare provider or your plan, or you can call SMP. If you're not comfortable calling the provider or the plan, or you're not satisfied with the response you get, call SMP and we are always happy to assist you. Next slide. Now that we've talked about uh, fraud, how to recognize it, how to protect yourself, how to detect it, and how to report it, we would like to invite everyone that may be interested in becoming involved in our program to volunteer some time. You might be wondering how you can help or become involved. Senior Medicare is always looking for civic minded individuals to help in our fight against Medicare fraud. The benefits of becoming a volunteer include the satisfaction of participating in a national effort to empower members of our own community like you to also learn how to protect, how to detect, how to prevent healthcare fraud, errors, and abuse. Our volunteers receive training on all the basics of Medicare, healthcare errors, fraud, abuse, and scams. This information not only enables you to become a great volunteer, but it's also information and assistance you can pass on to other individuals, to friends, to family members who might also benefit from your training. You can participate in bi monthly webinars and various training opportunities throughout the year. We host a volunteer appreciation event in April during National Volunteer Week, and all of our volunteers are invited, and you get to meet each other and have a really great time. Volunteering for the SMP program is very flexible and it's done on an as needed basis. You're offered opportunities and have the option to decline if you're not available for some reason. You determine how often you want to participate. We also want to mention that it's a great volunteering opportunity for couples. If you and your spouse are retired and you enjoy doing things together, SMP is a great bonding opportunity. And in the past, we've had couples team up to volunteer, and together they can give presentations and attend community events. If you think volunteering for SMP is something you might be interested in, please feel free to give us a call at our toll free number, 877 272 8720. We would be very happy and appreciative to have you, and we'll send you one of our volunteer information packets and answer any questions you might have about the volunteer process. Thank you for your time, and I'm going to turn things over back to Miss Sunny.
Thank you, Nathan and Yolandra, for that information. As Yolandra mentioned and Nathan mentioned, we do have a toll-free number. So this is just a look at some of the different ways that you can reach us or find out more information about Senior Medicare Patrol. We have a toll-free number, 877-272-8720, a wealth of information on our website, which is stopmedicarefraud.org. And if you like, we have the QR code on the screen right now where you can open your camera and scan the QR code for information. That information will take you to all of our social media platforms, including our Facebook pages, YouTube, our podcast, Sip and Learn with SMP, which is available on Spotify and Apple Podcast. So there's a lot of information for you all out there, and you can always call that toll-free number if you need more information. So coming up next month, our webinar Wednesdays, the month of September is dedicated to home health and hospice fraud. So our next webinar Wednesdays presentation is scheduled for September 27th at the same time, 10:30 Central Time. And so just be on the lookout, and we'll send information on how you can register for that next month. And as always, at the end of our webinar Wednesdays presentations, we do conduct a prize drawing. So everyone who was registered to attend today prior to 10:15 a.m., you've all been entered for a chance to win. The winner is going to receive their choice of a $25 Walmart or Amazon e-gift card. And I've put all of your names on the wheel. So we're going to give it a spin, and you do have to be present to win. So you have to be here. There we go. So it looks like we're going to go ahead and give it a spin and see who our winner is today. All right, it looks like we have a Gloria S. So let me just kind of look here and see if Miss Gloria S is on the call with us. Not seeing Miss Gloria. All right, so we're gonna give it another spin and let's see. All right, it looks like Sandra H, and I'm not seeing Miss Sandra's name on here. So we'll remove her name and give it another spin, and hopefully it'll land on one of you that's here. Mercedes J, and she is also not here. Okay, well, we're just gonna keep spinning until we get a name. Miss Claudia F, and I do see that Miss Claudia is here this morning. So Miss Claudia, I will be reaching out to you shortly to find out which gift card you'd like to receive. All right. All right, so before we wrap up today's presentation, I just wanted to open it up to questions. So if you have a question regarding the information that we presented today, please raise your hand. If you look at the Go To Control panel, there's a little hand button. All you have to do is click on it and we'll unmute your line and you can ask your question if you have one. I'll give everybody just a moment to find that hand button and let us know if they have any questions.
And the great thing about our hotline number is if you don't have any questions now, but one pops into your brain an hour from now, Monday through Friday, 9 to 5, call our 877-272-8720 hotline number. We'd be happy to answer any questions you have through our hotline.
Absolutely. Thank you, Nathan. Yes. All right. Well, I am not seeing any hands raised. There we go. All right, so this is going to conclude our presentation today on pharmacy and prescription drug fraud. You all will be receiving an email from me after the webinar today with the link to a short survey. We'd appreciate it if you would take a moment to complete the survey. I also shared it in the chat with you all before we started. It just takes a couple of moments.
I do see a late question, Sunny, from Miss Nancy.
Okay. Sorry, let's see.
Question says, what is grocery card?
I'm not real sure.
I think, occasionally you'll see certain Advantage plans offer you over-the-counter cards that you can use with your plan. And they're only available in certain plans. And those are sometimes legitimate, but the question is, before you make any switches to your plan, sometimes it's not a worthy trade-off. What if you, go into a plan where you get some type of over-the-counter grocery card or over-the-counter medicine card, but your doctor that you see that you really love isn't in network anymore? So that's one of those things. You just want to be very careful before being swayed into changing your plan for one of those benefits, that it doesn't take away a benefit you already have that wouldn't be a worthy trade-off. I hope that answers your question.
Yes, thank you, Nathan. Yeah, definitely want to make sure that you're still going to have all the same benefits that you had that you need before you switch to a plan, with the promise of these extra benefits. All right, well, I'm not seeing any other questions. So Yolanda mentioned my healthcare tracker. So yes, so whenever I send the email, If you'd like to receive a free healthcare journal, it's called a healthcare tracker now, but if you'd like to receive one, all you have to do is reply to that email that I send later with your mailing address, and I would be more than happy to send you one so you can have it for yourself and you can start keeping all of your personal healthcare information in that. All right, well, thank you everyone again. Thank you, Nathan and Yolandra, for the presentation this morning, and we hope you all have a great rest of your week, and we hope to see you again soon.
Thanks, everyone. Congratulations, Miss Claudia.
Thank you.